The coronavirus COVID-19 pandemic is defining global health crisis of our time and the greatest challenge we have faced since World War II. Since its emergence in Asia late last year, the virus has spread to every continent except Antarctica. We have now reached the tragic milestone of 1 million deaths, and the human family is suffering under an almost intolerable burden of loss, and we must work together to slow the spread of virus.
The Indian state governments have responded to the COVID-19 pandemic in India with various declarations of emergency, closure of institutions and public meeting places, and other restrictions indeed to contain the spread of the virus. Break the chain. On 15 March, a new initiative, Break the Chain, aiming to educate people about the importance of public and personal hygiene, was introduced by Government of Kerala. Arogya Setu. The Ministry of Electronics and Information Technology launched a smartphone application called Arogya Setu to help in contact tracing and containing the spread of COVID-19 pandemic in the nation. Atmanirbhar Bharat Abhiyan. On May 12, the Prime Minister Mr. Narendra Modi announced a special economic package of Rs 20 lakh crore aimed towards making the country ready for the tough competition in the global supply chain and empowering the poor, laborers, migrants who have been adversely affected by COVID-19. Following this announcement, the Finance Minister Ms. Nirmala Sitharaman in 5 press conferences announced the detailed measure under the economic package.
Since the global coronavirus pandemic began, Doctors Without Borders Medicines Sans Frontiers (MSF) has had two priorities. First, to keep existing essential medical services up and running for the hundreds of thousands of patients who rely on us, and second, to prepare for and respond to spread of virus itself. Faced with unprecedented challenges, our teams, like healthcare workers everywhere, have had to quickly adapt to the new realities of a world challenged by COVID-19 at a time when lockdowns and travel bans are restricting the movement of both medical staff and supplies. The challenges have been immense and we have adapted our entire way of working, said Bryce T. Lee Whitney. Global humanitarian organization, our surge capacity during emergencies is normally built on being able to move specialist experienced staff and medical supplies around the world at a moment's notice.
COVID-19 totally changed all over the world. The COVID-19 pandemic has interrupted classroom learning for at least 9 out of 10 students worldwide. 191 countries have closed all their schools, affecting over 1.5 billion students from pre-primary to tertiary education. The year 2020 has challenged governments and deepened socio-economic inequalities. The COVID-19 pandemic is considered as the most crucial global health calamity of the century and the greatest challenge that the humankind faced since the Second World War. ഈ ഒരു പാൻഡമിക് നമ്മുടെ ലൈഫ് സ്റ്റൈൽ എന്നെ മാറ്റിമറിച്ചു. സാനിറ്റൈസർ, മാസ്ക് നമ്മുടെ ജീവിതത്തിൻ്റെ ഭാഗം തന്നെയായി മാറി. പണ്ട് അക്ബർ ചക്രവർത്തി ബീർബലിനോട് ഇപ്രകാരം പറഞ്ഞു: "Tell me a sentence that if we read in happy times we become sad, and if we read in sad times we become happy." ബീർബൽ replied, "These too shall pass." ഈ ഒരു സിറ്റുവേഷൻ എന്ന് പറയുന്നത് ഒരിക്കലും പെർമനൻ്റ് അല്ല. നമ്മളിത് തീർച്ചയായും മറികടക്കും. ഫ്ലഡ്, നിപ്പ അങ്ങനെ അതിനെയൊക്കെ തരണം ചെയ്ത പോലെ നമ്മൾ ഇതിനെയും മറികടക്കും.